Hi, I'm Greg Corombos. My guest at this time is Grace Marie Turner. She's president of the Galen Institute, one of the most respected healthcare policy organizations in the country. We want to get her insights on the coronavirus response at the federal and state levels and from within the private sector. So lots to talk about here for the next few minutes. And Grace Marie, thanks for being with us.
Oh, it's a pleasure, Greg.
Well, I really don't want to get too political here, but obviously there's been a lot of back and forth on the Trump administration response. His supporters will say he was way ahead of the curve in stopping flights coming into this country from China when many thought that was unnecessary or even xenophobic. His detractors say he talked down the threat as recently as earlier this month. So what's your assessment of the speed, the efficiency, the competency of the federal response here?
When we look back at what people were saying, his critics today were saying when he did shut down flights coming in from China, they were criticizing him. And now they're saying he didn't act quickly enough. It's absolutely clear from the data that has given us extra time, which is the most important thing in a pandemic like this, to be able to buy time so that people can take action to try to, as we all know now, flatten the curve so you don't absolutely overwhelm your healthcare system with a sudden spike in cases. That's what happened in Wuhan, China, and what we're learning we must be able to manage in this crisis. So I now think one of the things that's happened in this, Greg, is that the political hits are now a bit more the exception than the norm, and I think that's really perhaps a silver lining in all of this. Yes, there's still some bullets flying, but they're mostly, they seem to sort of be off the mark now, rather than really focusing on what can we do together, what response is needed, what is the proper level of government to do the response, and what can we all do ourselves to try to really help to contain this virus.
You not only understand policy, you understand the logistics of the healthcare system quite well. So what do people need to realize is happening behind the scenes here? You've got this administration negotiating and talking with 50 different governors and other folks, mayors and so forth. So what is required to coordinate with that many different entities in quick order?
Well, the president keeps saying this is a government-wide response, and it absolutely is. It is just extraordinary to see the power of the federal government when all of the focus is on battling one common enemy, this invisible, deadly virus. Every agency is thinking about what can they do, how can they respond, what are their tools, their sources to be able to muster the most efficient response. And the only way that happens is when the president and the White House are absolutely engaged every minute, at least 20 hours, and I think probably sometimes 24 hours a day, to really figure out what can we do. The fact that they got the naval ship, the U.S. Comfort, to turn around and get itself ready to head into New York Harbor within literally days, hours, was an absolutely extraordinary effort. And I think that shows that when the government is focused on doing what it does best, it does it really well. But you also mentioned the private sector, and I know we're going to talk about that. They could not have done this without the private sector response. And yes, there have been missteps and slips up in government. The Centers for Disease Control absolutely dropped the ball in the beginning with being able to get testing capability out the door and approved as soon as possible. But that's a lesson learned, that agency was not really focused on its core mission at the time. It is now. A lot of lessons have to be learned, and I think we're going to see some government reorganization after this as well.
Well, we certainly did after 9/11, and I believe after the financial crisis. So when things go into crisis mode, changes are made when people see what doesn't work and what does. Grace Marie, you teed it up perfectly with the reference to the private sector. We're obviously seeing that a lot now at these daily coronavirus briefings. The president's got CEOs and other officials from companies stepping up to the microphone, talking about what they're doing. We've got Abbott Labs now with tests that can tell you if you've got coronavirus within 5 minutes, whereas before it was days. And I think I saw another report today that another test can do it in 2 minutes. We've got GM and other folks making ventilators. We've got different folks making masks and other gear for the medical professionals. What does it take to get that humming, both from the private sector perspective and coordinating at the federal level so you've got somebody making everything you need?
It is absolutely extraordinary. This is a World War II level response. There's some wonderful books that have been written about how essential the private sector was in the victory in World War II. We don't often think about that, but I think the story that's going to be written about this is how the private sector is stepping up, not only in production of ventilators and masks and all of the things that they're doing, grocery stores, keeping their supply chains open so people don't panic, or we're not having grocery store shelves filled at every minute. Every single company has been thinking about, what do I need to do in my business to help my customers? That is so extraordinary to me. We've all gotten, I got a message from the pest control agency, for example, that, what they're thinking about, the lawn service, the gardening services. Everybody's thinking about how can we adapt to this crisis. And then people who have production capabilities are stepping up and reprogramming their assembly lines to be able to make needed equipment. I think probably the biggest and most important sector right now, of course, is the pharmaceutical sector, the one that people like to call a bunch of crooks that need to be privatized and put out of business. Well, they're the ones who now have at least 24 clinical trials in progress right now to come up with a vaccine. Others doing clinical trials to test a lot of the existing medicines to see if they can be repurposed. Maybe they can fight this virus. This has happened with lightning speed. I saw on Facebook the other day that there is some researchers that work in laboratories in university labs, and obviously they're not able to go to work. So what are they doing? They're putting together a global network of expertise to help people focus their energies on what they know best to come up with a solution. I think we're going to see this happening sooner than we ever possibly could have imagined. Information and global travel have caused this virus to spread around the planet with lightning speed. I think we're going to see with lightning speed the responses and the treatments and the cures and the ability to be able to handle this virus also is going to really it's going to be a tremendously important story.
Grace Marie, you mentioned that one of the black eyes here was the slow uptake on the CDC to get the ball rolling on testing. Anything else that you see right now that needs to be a bigger priority?
Oh my goodness. I think getting the testing equipment out and distributed, and particularly to the hot spots. When we look at other countries, I did a piece late last week on looking at lessons we can learn from other countries. Everything has gone wrong in Italy. In South Korea, they are doing so many things right. And one of the things they're doing is testing. We want to know 3 things. Are you sick? If so, we are going to we're going to separate you from the healthy people, hopefully even from other family members, so that you can get well. If you are sick enough to need hospital care, we are going to also quarantine you, but we are going to have the resources to take care of you. If you have had it, we need to know that too, because a lot of people are stepping forward who've had it and recovered because they now have, their blood now contains the coding to be able to help people get well who are sick, or to be able to vaccinate healthcare workers. So we've got to know where people are in these various categories. The naval ship, the Comfort, that's outside New York Harbor, is, I understand, going to be used only for people who are not sick with the virus, to isolate them from everyone else so people in the hospital can get the care that they need with the ventilators and really emergency care. So keeping people apart, understanding who's had it and is well and now is immune, maybe some of them can go back to work. being able to come up with the treatments for people that some of these, like hydroxychloroquine and the Zithromax, to see if in fact those actually help people to get better, can be used to protect healthcare workers. I mean, there's so many things that need to be done. There is not one answer to all of this, but we've got to figure out how to separate people, how to test so we know what category you are in, and to make sure that we contain the virus as much as possible. As you know, Greg, we're now in Virginia under stay-at-home orders from the governor, and that lasts until June the 10th. And so hopefully between now and then, we're going to see evidence of new vaccines. We're going to start to see evidence of treatments that work. But the thing that we know now works is stay at home and don't give any germs that you might have to anybody else. And most importantly, don't get them from somebody else.
There you go. Social distancing is definitely the key word. Right now, the federal order till the end of April. And as you said, in some states like ours in Virginia, June 10th is the limit, although it could be ended sooner if things go well. But we'll be watching. Grace Marie, always great to have you with us. Thank you.
Such a pleasure, Greg. Thank you.
Grace Marie Turner is president of the Galen Institute. I'm Greg Corombos reporting for Radio America.